My name is Sashina Hines, a member of Group 4. Our presentation is on Tinea capitis. It will be in the form of a school challenge quiz. It entails morphology, precautions, treatment, transmission, portal of entry and exit, and role of a nurse. Our group members are Tony and Winter, Peter Ebanks, Stacy and Williams, and Shanique Nicholson. I hope you all enjoy our presentation.
Good afternoon. Welcome to the final match in round 1 of School's Challenge Quiz. Today we have Knox College from Manchester going up against UEMONA from St. Andrew. I am your host, Tony and Winter, and the action begins now. We did a coin toss earlier. Knox won and decided to go first. In section 1, questions will be thrown out alternately to each team, where they'll have 10 seconds to answer. Knox College. What are some characteristics of Tinea capitis?
Moderate to extreme scaling.
Scratching and hear loss.
That's correct. UEMONA. How does Tinea capitis spread?
By skin-to-skin contact with an infected person.
That's correct. Knox College. Why is Tinea capitis called a ringworm?
Because of the ring shape.
That's correct. UEMONA. Which two animals are mostly carriers of ringworm?
Cats and dogs.
That's correct. Knox College. What are some precautions to be taken by a nurse when handling patients with scalp ringworm?
You must wear your personal protective equipment, practice hand washing and sanitize and disinfect the area.
That's correct. UEMONA. How does Tinea capitis spread?
By skin-to-skin contact with an infected person.
That's correct. UEMONA. Is Tinea capitis aerobic or anaerobic?
Aerobic.
Correct. Knox College. Look at the monitor and identify the following personal protective equipment.
Glove, mask and gown.
That's correct. UEMONA. How long should Tinea capitis medication be taken for?
1 to 3 months.
Correct. Knox College. What causes Tinea capitis?
It is caused by superficial fungal infection on the skin of the scalp, eyebrows, and eyelashes.
That's correct. UEMONA. This is a visual question. Look on the monitor and identify the type of ringworm.
Tinea capitis.
Correct. Knox College. What are favors caused by?
Favors are caused by trichophytans, scolionellae.
That's correct. That's the end of section 1. The scores are UEMONA 6 and Knox College 6. We'll be right back.
Called as scalp ringworms. This is not a worm but an organism like a virus or a bacteria which is not visible to the naked eye, but it causes infections of the hair, skin and nails. The specific group of fungus which causes the scalp infections, it belongs to a group called as dermatophytic fungus. Now this is something which is fairly common in school going children. It's characterized by formation of a greyish or a scaly patch on the scalp where there is loss of hair. The children usually complain of excessive itching. This is one sort of presentation. The other sort of presentation is when there is formation of pus-filled lesions or pustules and pain or mass-like appearance on the scalp. The treatment of this is antifungal therapy, which includes oral medications and applications. So this is a skin condition which can be very well controlled with the usage of application medications and oral tablets.
Welcome back. It's time for our buzzer section. In this section, questions will be thrown open to both teams. The first team to press the buzzer and be identified will earn the right to answer. Each team will earn 2 points for correct answers and will lose 2 points for incorrect answers. Let's get started. True or false? Children cannot contract scalp ringworm by touching and petting. That is infected. Uemona?
False.
That's correct. True or false? A nurse should treat tinea capitis patients different from other patients. Knox College?
False.
That's correct. Name 3 objects that can transfer ringworm. Uemona?
Comb, hat, brush.
Where are arthrospores developed? Knox College?
Inside of the hair shaft.
That's correct. True or false? A nurse should provide emotional support and suggest hairstyles for a tinea capitis patient. Knox College?
True.
That's correct. True or false? Tinea capitis is a highly contagious infection for both humans and animals. Uemona?
True.
That's correct. How do nurses handle samples of tinea capitis patients? Knox College?
They remove the ointment or any lotion with a alcohol. Use the back of the scalpel blade to scrape material on the black card provided by the lab, and then transport it to the lab where it is kept at room temperature.
That's correct. True or false? Selenium sulfate shampoo is used to treat scalp ringworm. Uemona?
True.
That's correct. True or false? A nurse should ensure patients get a full dose of medication. Check for any side effects and retest samples. Knox College?
True.
That's correct. Where are ectothric infections developed? Knox College?
On the outside of the hair shaft.
That's correct. This is a visual question. Look at the monitor and identify the type of scalp ringworm. Uemona?
Tinea capitis.
That's correct. Is tinea capitis gram-negative or gram-positive? Knox College?
Gram-positive.
That's correct. What is used to treat tinea capitis? Uemona?
Prescribe antifungal medication. Grasolve.
That answer is incomplete. The correct answer is Grysolvin. To the end of a fantastic showdown. The final scores are Knox College 20 and Uemona 18. We'll take a quick break. When we get back, we'll wrap up. So again, the final scores are Knox College 20 and Uemona 18. In the true spirit of Schools Challenge Quiz, we invite both captains to shake hands. So again, congratulations to Knox College and well played, Uemona. See you next time.
Introduction. The topic, the unwanted ring, arrived from our team, Tinea capitis, ringworm of the scalp. Tinea capitis is a fungal infection of the scalp and hair shaft. Tinea capitis is a geographical widespread group of fungal infection caused by dermophyte fungi. This research will practically be focusing on Tinea capitis, ringworm of the scalp, a highly contagious infection that predominantly occurs in children. The researcher chose this topic because they wanted to educate themselves and others on the symptoms, precautions that should be taken, portal of exit and entry, microorganism, role of the nurse, treatment and mode of transmission of the Tinea capitis. Tinea capitis remains a common childhood infection in many parts of the world, yet knowledge of the underlying pathogenic mechanism and the development of the effective immunity have shown striking advances, and new methods of diagnosis ranging from dermoscopy to molecular laboratory tests have been developed, even though they have been assimilated into routine practice in many centers. Treatment is effective, although it needs to be given for at least 1 month. What is missing, however, is a systematic approach to control through cases ascertainment and therapy. However, last 10 to 20 years, Tinea capitis has changed with widespread of organism. This project contains a comprehensive overview of the topic, Tinea capitis, and the method of data collection used was direct observation and research.
Microorganism, causative agent. After puberty, changes in fatty acid content of sebum are assumed to inhibit dermaphytite growth and contribute to a drastic decline in disease incidence. Characteristics of Tinea capitis. These include moderate to extreme scaling, hair loss, scratching, erythema, and occasionally pustules or carrions. Tinea capitis starts as a thin erythematous papule around a shaft of hair on the scalp, eyebrows, and eyelashes. Dermatophytes are aerobic fungi classified into genera Trichophyton, Epidermophyton, and Ectothrix. Infections develop on the outside of the hair shaft with dermatophyte arthrospores and cause hair breakage just above the surface of the scalp. Arthrospores develop inside the hair shaft in endothrix infections, so hair breakage happens on the surface of the skin. Favus, caused by Trichophyton squenlenii, is a particularly severe form of Tinea capitis, which on the scalp and hair follicles a thick inflammatory crust forms. If untreated, this can lead to scarring and irreversible alopecia.
Portal of entry and exit. The fungus invades the keratinized stratum corneum. Portal of entry and exit. The fungus invades the keratinized stratum corneum of the scalp and grows downwards into the hair follicle and the hair shaft. It enters the hair cuticle and naturally attacks the hair shaft in one of these ways. 1. Endothrix infection. This is where dermatophyte attacks the hair shaft and grows inside it. Fungal spores are taken inside the hair shaft and the cuticle is not destroyed. Favus infection. This is a chronic dermatophyte infection which is characterized by a cluster of hyphae at the base of the hair, with air space in the hair shafts. A yellow crusting around the hair shaft is observed clinically. This infection generates from T. scolenii. 3. Ectothrix infection. Dermatophyte breeds inside the hair cavity and covers the surface of the hair. On the external surface of the hair shaft, fungal spores are observed and the cuticle is destroyed. One example of Endothrix dermatophyte is M. canis.
The mode of transmission are skin to skin, animal to persons, and object to person.
Diagnosing ringworm of the scalp. The healthcare provider or doctor will diagnose the ringworm by examining the area of the skin, possibly by using black light to view the patient's skin in the affected area. Patients' doctors can often make a diagnosis of ringworm or another condition affecting the scalp based on visual examination of the scalp and your answers to questions. The healthcare provider may take a sample of hair or skin for examination under the microscope. The test may reveal the presence of fungi and help confirm a diagnosis.
Treatment of scalp ringworm include greaseofulvin, terbinafine, itraconazole, and fluconazole.
The role of a nurse. Nurses are on the front line of patient care. They play a vital role in the fight against infections worldwide. Nurses ensure that patients receive the full dose of medication prescribed for Tinea capitis. They check on the progress of patient's condition and check for any worsening or side effects caused by the medications. The nurse will instruct the patient and family members not to share personal items such as brush, combs, towels, and pillows. The nurse would instruct the patient to keep the skin clean and dry and to wear clean clothes daily to prevent tinea capitis. In the hospital settings, while handling of the sample, the nurse would wear personal protective equipment, practice proper hand hygiene, sanitize and disinfect the environment. While dealing with tinea capitis patients, a nurse should always keep a positive attitude, show respect and compassion. A nurse should promote and protect the rights of patients at all times. A nurse should always be attired in their personal protective equipment. That is your gown, your gloves, and your mask. The nurse is going to wipe with alcohol any ointment or lotion that is on the scalp. They're going to use the back of the scalpel blade to scrape the scalp or use a toothbrush, a disposable toothbrush for kids, since the kids are not going to sit and allow them to use the scalpel blade on the scalp. The scalpel blade is going to scrape material directly on the black card that is provided by the laboratory. The sample will then be placed in a dry, sterile, labeled container and transported to the laboratory where it is stored at room temperature. The nurse will then remove their PPE and practice proper hand hygiene. While monitoring the patient, the nurse will ensure that the patient receives the full dose of antifungals that is prescribed by the doctor. They will ensure that the patient is taking the medication the correct way that it should be administered. They will check up on the progress of the patient and take over samples. Of tinea capitis. The nurse will instruct the patient that once treatment has begun to discard all combs or brushes and get new ones. Wash the hair at least twice a month with antifungal shampoo. Don't share personal items such as hats, comb, or brushes, and always keep the skin clean and dry. For the precaution of the nurse, The nurse should always wear personal protective equipment, practice proper hygiene, sanitize and disinfect the environment or any tools that were used. A nurse should display professionalism at all times. A nurse should dress attired and ready for work. A positive attitude should be shown at all times. Show compassion and respect for the patient. Promote, advocate, and protect the rights of patients. And to work in a team to carry out effective care for the patient.
In reflecting on our project, starting our research on scalp ringworm, Tinea capitis, we were aware of only what scalp ringworm is and a few of its symptoms. We are now equipped with a lot of information on what causes scalp ringworm, which is the trichophyton species. We have also learned that we're not to share items such as combs, brushes, hats, and towels with persons, as that too may lead to us contracting the infection and puts us at risk for alopecia. As student nurses preparing to go into the hospital, we will be equipped to handle patients with the infection and be able to educate them on how to treat the infection and limit the spread. This project has allowed us to gain extensive knowledge to become better nurses.